Welcome to Warriors Within, the podcast that amplifies the voices of sickle cell warriors and their families. I am your host, Coco Chanel, here to guide you through the real, raw, and resilient stories of sickle cell warriors and their everyday journey. I'm here with my wonderful guest, Melissa. How are you?
I'm good. How are you?
I'm doing good. Thank you for joining me.
Thank you for having me.
Okay, so Melissa, I just want you to tell me a little bit about yourself. You did tell me you are a sickle cell warrior.
Yes, I've been a warrior. Family found out when I was a baby.
Okay.
Almost one. Told my parents that I wasn't going to make it to 18. I am 37.
Look at you.
Yep, and hopefully going to make it to like 107.
Yep, exactly. The many more years to come.
Many more years to come.
So what is your nationality?
I am Haitian. Well, my family's from Haiti.
Okay.
I was born in New York, Brooklyn, New York.
So that's interesting. How did your parents go about educating themselves with sickle cell?
They knew nothing about it.
Oh, wow. So it took you to come along.
Until I came along.
Okay.
Right? So they were scared, because doctors telling any parents that your kids are not going to make it to 18. I think that's a scary thing. So,
yes.
My parents did research on it, and then my mom became a nurse. And so then she was able to gather more information and, kind of teach me growing up, like, you can't do this, you can't do that. Those other kids could keep running around, but you need to stop. You need to hydrate. You need to take a break. You can't get too tired. So she always kind of instilled that in me, like, as I grew up, because she went to, get her own research. But before that, my parents knew nothing about sickle cell.
So what do you recall your first crisis being like?
So my first crisis, I didn't know it was a crisis.
Okay.
So I was a kid and I remember having like bad back pain and just crawling in between my parents in bed, like crying, telling my mom, listen, my back is killing me, and her getting like a warm towel or
like
putting a towel in the microwave and putting it on my back and giving me some like baby Tylenol or some kind of medicine that I thought was yucky. But then I would take it and like I would feel better. Bad crisis. I think I got like the chicken pox from my other siblings. But then like that sent me to the hospital. And then like I think that's when I discovered what a real crisis was. Like, they got the chicken pox and they didn't have to go to the hospital. But I had all this pain and I had to go through it. But I think still as a kid, I still didn't understand. I just remembered what my mom instilled in me, that listen, you can't do this, you can't do that. You need to hydrate. You can still play, but not too much. Like, don't get yourself tired. Making me go to sleep, making me eat a bowl of beets every night.
The nasty stuff.
That nasty stuff every night that my siblings didn't have to eat.
You said, so you got siblings. Are you the only sibling with sickle cell?
Yep. My brother got the trait. And then my sister didn't get anything.
So you're the leader of the group.
Yeah, but, I don't think they could handle it. I see how they do when they're sick.
That's what you said. I'm a true warrior. God gifted this to the right one then.
I feel like, God gave it to me for a reason. And like, I didn't get sick as much as a kid. Maybe because my mom knew, kind of educated herself and told me what not to do. And then I just listened. Because I didn't start getting real bad crises, like unavoidable ones when I was a kid, maybe once or twice a year. But it wasn't until college that I started really getting crises. And I'm thinking that's stress because I was also working too.
Yeah.
And, being an adult because you have to work and go to school and things like that I really started experiencing crisis like frequently, where I have to go to the hospital like maybe 6 or more times a year. Whereas when I was a kid, maybe once or twice, unavoidable, maybe due to the weather.
Yeah.
And I lived in New York. Like,
which is a cold state.
Exactly.
It doesn't do well with sickle cell warriors at all.
That wasn't bad at all. Like, I don't remember as a kid being bad, but an adult, yeah.
So, what do you recall when you went through your crisis in college? What do you recall yourself thinking? Like, what were your thoughts? Because obviously, you said that was like when you realized that was when your real these are real crises, and now it's probably was hitting you then.
It was my roommate. Like, she's a white girl. And I remember she not knowing what to do. She's like, oh my God, should I call help? Like, because like I was having real bad crisis in my legs, and
you couldn't move.
I couldn't walk on it. I'm like, you need to call my mom. And that was when my crisis but I wasn't taking care of myself. So
college.
I was living it up. I was drinking. I'm doing all these things that I wasn't doing when I was younger.
Of course.
Under my mom's care, right?
Of course.
So I was drinking. I was staying up late all the time. I wasn't resting. I was doing more than I'm supposed to, like, not resting enough.
Yeah.
So I'm still
and
trying
overstressing,
to party and still get my work done and still have a job. So I was doing all of that. And then so when that crisis hit me that one time in college, that was my first real bad crisis, because that crisis was so bad, I needed physical therapy to help me learn how to walk.
Walking.
Yeah.
It took out your mobility.
Yeah. I literally have the walker in my parents' garage that I see it with the tennis balls on the bottom. And that reminds me of like how bad that crisis was.
So that crisis really opened up your mind to be like, hey, I
need to take better care of myself. Like I was definitely not doing what I was supposed to. Like probably even just taking my folic acid daily. I don't think I was even doing that.
Oh, wow.
Yeah.
So yeah, you really weren't.
My mom's gonna see this.
Sorry, Mom. But she's taking care of herself now. That's what matters the most.
Yeah.
So after let me elaborate on this. So you went to school, and what did you graduate in college for?
Okay, well, I became a nurse.
And that is wonderful.
Yes.
So let's dive into that. Like, not only are you a sickle cell warrior, you're a nurse.
Yes.
So I asked you this before. So did you work in the hematology department?
Well, I did work with hematology, and I have taken care of sickle cell patients. And I've had nurses like, oh, I don't want this patient. Them not knowing I have sickle cell.
Yeah.
And I'm willing to take them. I'm like, oh, yeah, absolutely. I don't care if they're Q3. I'm going to take care of them. And I remember telling my patients that have sickle cell, like, I have sickle cell too. I understand. And they're like taking down their defense.
Yeah. They
knowing that their nurse understands. And then, they would be like, how'd you do it? I had one patient, he passed away, and like that broke me. Because he was like, I'm gonna go to school too, like you're motivating me. Like we can do anything we want to do. And he's like, I'm gonna go to school. Like, he's like, I told my mom about you and all that. Yeah. I had a crisis, and that 2 weeks that I was out from work, I came back, and then like they knew like
you were gonna be hurt.
Like every time he was there, I didn't mind being his nurse. I'm like, oh yeah, give him to me, give him,
Yeah.
And they were like, I'm so sorry, I didn't want to tell you this. I think I had a crisis again right after that.
Oh, because it really bothered you.
Yeah, that really bothered me. To this day, it's still, you know what I mean?
Yeah.
He wanted to do something with himself. And it's just so heartbreaking, because it's like the amount of like patients like that I've met, like going to the center and the clinics, FSCDR or memorials, things like that. And like lately it's been like every other month or something, we're finding out another person has passed. And it's like, I'm starting to not even want to be friends or get to know anybody with sickle cell, because I don't want to hear that or be sad anymore. I recently just lost my friend Sonia, so she would be proud of me that I'm doing this, because she was always planning events and wanted me to do things like this. So this is for you, Sonia. I'm sure
she is more than proud. I guarantee you that. I want to ask you, what is a narrative, or what have you seen since you're a nurse, and it's funny because you're a nurse and you're a sickle cell warrior, so you like get to put on both sides of the shoe. What do you notice when you're in your nurse duties and you get to see with your sickle cell warriors and your patients, and when you actually take care of them? Like, what do you notice? Because
a lot of nurses and doctors don't need to be nurses and doctors.
I can agree with this.
Like, I've had some close coworkers that knew I had sickle cell because I didn't tell everybody. And I remember us being at a nursing station and the doctor just was going on about, oh, just push water. You'll see. They're just seeking. They're not really in pain. And he's just going on. And I remember my coworker knowing I have sickle cell and she's just looking at me because she wasn't sure how I was going to react or what was I going to do in that moment. You know, hearing what this doctor had to say about a sickle cell patient. I didn't say anything to him, but we definitely reported him for sure, like took action. But just hearing things like that, you know what I'm saying? And it's just like, it's so fake. Like, I've encountered so much, like they'll say and things in your face. I'm like, oh my gosh. And then they find out you're a nurse and they're being super sweet and whatever in the room. And then outside they're saying things.
Yeah.
And they don't know who I used to work with, who's coming back to tell me everything you said. So, yeah, that's the thing in the healthcare field. It's like, treat me the way you would want your family or you to be treated if it was your kid. You know what I mean? And it's just like that perception that we just want
to
drugs.
Be broken. Yeah.
It's crazy to me. Like, if we just wanted drugs, we could just go out on the street and get drugs.
Literally. You know and do it the quick and easier way.
We're here because we need help.
Yes, a lot of help.
We want relief. That's why we're here.
And it's not just because you're taking it, the abundance because you want to.
Exactly.
And I do agree, because that's also a narrative I
think everybody has that same nightmare and horror story. Like, when we're talking about the same things, everybody's saying like the same thing.
Yes.
Like,
every warrior has. That's why I asked you, what was your point of view on the the medical side? Because every warrior does have that point of view where they don't feel as if the care in the medical field is really like care. Like, it's not like care. I mean, my story, on one of my episodes I told somebody, like, my son, they told me, because I didn't want him to take a certain medication. They gave him a lot. They told me, well, you shouldn't expect him to live long.
Wow.
And in front of him, in front of me, that's the wrong thing. So I totally agree with when it comes to, like, healthcare. It does needs to be, it needs to be people that care.
Educated.
Yes.
Like I had a doctor that told me that he's never seen or heard of a sickle cell patient with a chest port. I was like, oh, wow. Yeah. Because usually that's the first thing they'll ask you, because they know our veins are bad.
Right, yeah.
In the ER is, do you have a chest port? And this doctor told me he's never heard of a sickle cell patient with a chest port. So, yeah, a lot of them need to be educated. I know that they were trying to pass a bill to have these doctors take these classes before they renew their license or something like that. I think that would be great for us. And I think it should be all healthcare professionals, not just the doctors, the nurses too, because the doctors, they'll only come in for like 5 minutes, but the nurses, they're the ones
that's really there,
and they're the ones that's supposed to advocate for you. And I find that they don't do that, and they're afraid of the doctors sometimes. It's like, call the doctor, tell them this medication is not working for me. Why are you scared to call the doctor? Why aren't you advocating for me? And and
so your patients probably love you because you definitely go the extra mile.
No doctor.
Yeah. I love that. I love that.
Yeah.
So tell me, what encouraged you to become a nurse?
My mom.
Yeah.
My mom. She always wanted me to do something that she wanted to know that I'll be able to take care of myself if I'm not here. And then I did want to be in the healthcare field. So when I went to school, I thought I wanted to be a pharmacist. And then I hated chemistry after organic. And then so I had all these science credits. And then I was just like, yeah, I could do nursing. And I went in and it was like smooth sailing. Like,
how do you like balance between nursing and then like
I don't even
Like,
know sometimes.
Because I always wondered that. Because if you were, I mean, obviously, I'm in the hospital with my kids, so I can only imagine if you were my kid's nurse, and I'm like, I would be asking, like, are you tired? Are you running on your feet? Like, you're going at 5 different patients, you're running on different floors. And then it's not even that, it's the mental loop.
Yeah.
And then it's the emotional loop, because your patients do tug on your emotions as well. I feel nursing is a real emotional job.
Mind over matter is real.
It is.
So I was doing it and I was not thinking about it. I was never thinking I had sickle cell until like I felt the pain. Like, oh yeah, I got sickle cell. So I think putting in your mind, like, you can do it. Like, and that's what my mom always tried to instill in me. Like, just because you have this, don't let anybody tell you you can't do anything.
Yeah, no limitations.
Because like, I've had doctors and I would cry about it. Like, because I would always talk about having kids. And they'll be like, oh, somebody like you shouldn't be talking about having kids. Like, a doctor really told me that. And here I go meeting all these sickle cell patients with kids.
Yes, I was going to say, I don't know why they would say that.
And they're doing good and they're striving, and some of their kids don't have sickle cell. So it's like, you know, like, you can't let people tell you what you can or can't do.
No, you can't. You can't.
So, yeah, that's when my mom, my hero, she was like, you can do it. And she was still tough with me. Like, you better come with them A's. She was tougher than me than my other siblings, actually, because I always made the A's. So if I came home with something less than an A, she was like, what is this? So, yeah, mind over matter. Anybody you can do, like, don't let them limit you to, you know, like, not finishing school. Like, I know you're gonna get sick, but there are resources. Like, we do have a disability.
Yeah,
it is a disability. So they have people to take notes for you. They have people to excuse your absences because they know you're out sick. You get what I'm saying? They'll just fill out your FMLA with work. Even, like, especially when I get my cycle, that's when it hits me the worst. I know that, okay, yeah, I can't do it. Like, my whole body hurts, you know?
Yeah.
I have FMLA to protect me at work.
Yeah. Certain things protection boundaries that you can have.
So, I mean, I guess that's how I go about it. But then, like, I just try not to, like, it's the pain that reminds me I have sickle cell.
So then how do you mentally, because it's also a mental factor. I say when you're a nurse, you know, because you got patients, and like I said, it's really the patients, because I always try to put myself in everybody's shoes.
Yeah.
So you have patients, like you just said, like you had a patient that had sickle cell, so you could really correlate to them, and then you have like 4 other patients that's different. So mentally, how do you balance that?
It's tough, because it can get frustrating.
Yeah.
And that's why, like, I want to do the gene therapy, because it's like, I started off to being a normal kid to now that I'm an adult, I'm starting to get pain like all the time. And it's like, it's draining, because it's like, I can do this event, but I can't do this. I got to go rest, because if I do too much, I'm going to get sick, you know? So it does play a toll, but, like, I try, like, you know,
to push past it.
I try to see, like, there's people that's going through worse things also. I'm like, just, you know, you're still able to get up. You're still able to walk. You know, you're still able to do a lot of things that other people can't do.
Yeah.
Some people, like, I mean, cancer is tough, right? So that's what I mean, it's hard. I really don't. I think the support of my family is really what helped me more with my mental. And then, like, the support of, like, relating with other sickle cell patients. As much as I don't want to be friends anymore with any more patients, because it breaks
your heart. It does, because then it makes you kind of feel like it's like is my time gonna come, I guess you could say.
I try not to think, like, I try to, you know what they say, like, manifest, like.
Yeah, no, for sure, because it goes back to what you said, mind over matter. I'm a big person that what you think it can become. So definitely. So I want to dive into this gene cell therapy.
Okay.
Why do you want to do gene cell therapy?
Because I don't want to be in pain anymore.
I understand.
And, like, I don't know. So when I was at the hospital with my mom, going through a crisis. I think I just had got into it with pain management. I fired them, by the way. You can fire them, people. And Good Morning America came on, and it was a guy, a woman, and a man, and they had kids and they had their family, and they were talking about how they just did gene therapy and they're living their life like normal. And me and my mom were in there like, how, like, what is the odds that this came on while we're here in the hospital? Because my mom stays with me in the hospital on the recliner. She never leaves.
Never leave. That recliner knows moms for sure. I can tell you that much.
And I feel like it just came in like a blessing for me. And then it's just been like, since we've heard about the gene therapies, like doors kind of been opening, right? Because like the one insurance that I have with my job is Blue Cross, and Blue Cross is covering gene therapy. So I was like, wow, that's a door that opened up for me.
Yeah.
So I'm just like, I feel like these are just signs from God. It's just a fertility process now because I'm a young woman, a young widow. And yeah, you know, I do want to have kids of my own one day. So I'm trying to freeze my eggs. So it's that process that's kind of taking a while. And then I know the gene therapy process takes a while too, but I'm not going to give up.
So estimately, because obviously I would tell people to kind of elaborate on, can you explain how long is the process of gene cell therapy?
I think it's like 6 months to a year. And then I think they want to monitor you after that. Make sure, you know, like, and run tests and make sure everything is okay and that it's working, you know, and for their research and things like that, that they're still doing, I think.
And with the fertility part, they freeze your eggs to make sure that they can put them back so you can have children.
Yeah, because you have to go to chemo.
I was gonna say, is there any cons? You just said that chemo.
The chemo, yeah, that's the scary part.
That's the scary part.
I think that's the scariest part. And so many people when I tell them that, they're like, just pray.
Yeah, because that's
just pray. Yeah.
Anything unknown, I feel like that's what you should do. Anything unknown,
just pray on it.
Yeah.
And that's why I'm just like, you know, and then like I'm like, let me just be positive about it, because, you know, I've been diving in, doing my research. Yeah. Like, it's 4 days of chemo. So I'm like, okay, it's just 4 days. It's just 4 days, you know. I feel like it's not as extreme as maybe a cancer patient would have to go through. So that's why I'm just like, okay. Like, I just kind of trick my mind into, okay, it's not that bad. It's not that bad until I get there and do it. But like, I have so many patients that said they're waiting on me. They're like, Melissa, we're waiting on you to do it, so we can know. Yeah.
Okay. So
I have a lot of people counting on me. So,
do you have any nervous factors?
Oh yeah, I'm nervous as heck.
Okay. So what are you nervous about?
I'm nervous about the chemo, how it's gonna make me feel.
Okay.
I'm also nervous. I've heard like it doesn't work, you know. And I'm just like, well, if it doesn't work, then what, you know, what do I do? Then like I'm back to square one. But
and if it does work, what's the first thing you are going to do?
Oh my gosh, I just want to see what it's like to feel like energy.
I know what you mean.
And be able to, you know, do things and do multiple
like
things.
Like you said, go hiking and go swimming, go jump out, go skydiving. So I know exactly what
I have my hemoglobin higher than 11.
Yeah, I know what you mean.
That without a blood transfusion, like my normal's an 8. Like, I don't even know. And then like, I guess feel like I'll have like more life, you know, to live and be free. And then I would like to have a family of my own again, you know, like I was married, so maybe get married again. I'm not looking or into being in a relationship right now because I'm more focused on getting myself better.
Yeah.
I don't want to put anybody through what I'm going through right now. And like, yeah, my mind's just not there.
So do you find it hard to have like partnerships with like would also be in sickle cell anemic?
To explain that to people who don't know. Yeah. Because it's not everybody knows what sickle cell is.
It's true.
I literally had this conversation with my Uber driver the other day. It's like, what's sickle cell? and I have to like explain
Educate
it to
it.
him. Yeah. So
I'm pretty sure you have partners that you probably like really, really liked, and you had to like break down to them like,
my
this is my
husband, when
condition.
he seen me have my first crisis, he was scared.
Oh
like,
my
And
goodness.
you could see how scared he looks, but I can't console you right now.
Yeah, because I'm in pain. So how did that go? How did that process go? I'm pretty sure he said if he
tell him, call my mom. Call my mom.
That's all you can do. Please call mama.
But like he kind of learned what to do
Over time.
Yeah, and started doing his own research. You get what I'm saying? But it's like, how do you, like when you start dating, like, oh yeah, I have sickle cell. Like, how do you just put that on somebody? I don't even remember when I did tell him. I think probably is when I got sick and like
That's when you had
to him.
to.
I don't think I just came out right and said I had sickle cell to him. No.
So did he take his time to actually? Well, you said he learned along the way.
Yeah.
So he took his time to educate himself.
This man like thought he was
a doctor.
Yeah, making me all these like juices, like
that's good.
Like,
that's good.
All these things and like giving me these different vitamins, and he's like, oh, I seen L-glutamine. They said this is supposed to help you, but that was cool that he was actually doing research and he was trying to help me and buying me all these vitamins and things to try to help me get better, you know. So then he knew like he would start to do the things that my mom do to me, like, oh, you can't do too much, or I'll turn around and he have a bottle of water, like, here, drink, like just little things like that. Yeah.
So is there something that like, well, I know you said you want to start your family and everything. So if you go through with a gene cell therapy and everything works out, how many kids do you want to have?
Oh my God.
Because I mean, they're going to freeze your eggs. So
I'm 37. I was thinking too, I just want the best of both worlds. So
you just want a healthy kid.
If I can get a boy and a girl, I'll be perfect. I'll be set. So 2 would be good.
I like that duo.
Just the best of both worlds.
It is. It's definitely the best of both worlds. Yeah. So what do you like as far as, because now that you like, you elaborate your eagerness for gene cell therapy, what do you hope for in the sickle cell community to make awareness? Like, what do you hope they amp up more in the community?
Well, one, I don't think... Like, I was having a conversation with one of my friends, right? And I was like, she went to go do the bone marrow.
Mm-hmm.
And I am so scared for her because I did lose a friend or someone I knew to the bone marrow because her body rejected. So to me, I'm like, why would you do that one? That one is so scary. Like, why wouldn't you do the gene therapy? Like, the most that can happen if it don't work because it's your blood, it just doesn't work, but it won't kill you. And she was like, Melissa, my insurance doesn't cover it. You get what I mean? And that hit me because I'm like, okay, shut your mouth.
Because you didn't know her situation.
Yeah. Like,
everybody's different. Yeah.
I have Blue Cross because of my job, right?
Mm-hmm.
But not all the insurances want to cover that. So I'm like, why don't you want to cover that? When I talked to the case management for Blue Cross and I was telling her my interest in doing gene therapy, she was like, yeah, we just did it for a little boy in North Carolina. And she was like, it actually is a cost a lot less to do that than all the amount of hospital visits you guys have and doctor's office visits and medications and all the stuff you guys have to go through. So I'm not sure why these other insurance companies are not picking up on it, but they're helping with the bone marrow, right? But then that one is 50-50. Like, if your body rejects, it rejects, right?
Yeah.
And then, like, what can you do? But then the gene therapy, if it doesn't work, it doesn't work and it won't kill you. But at least if it does work, you know, could have a better life and living. So that, more education for the doctors when we go to the hospitals, like, and the nurses, more advocates for us in our community. I want to try to be an advocate. And
you definitely can. It starts with you're doing that when you honestly work with your patients. Like that is advocating right there. Because talking to them enough, like I tell people all the time, like the nurses that come into the room, y'all just don't know, just sitting here talking to us for 5 minutes kind of just helps out. Even if we just get to know you for like about your dog, I don't even care. Like long as we like it gets a comfortability to know. So you are advocating when you do that. I promise you are.
Yeah.
And like I said, anybody who like that is supporting you, like you said, you shouted out your friend earlier. Yeah, they are definitely proud that you make awareness to do stuff like that.
Yeah.
So to continue back to the gene cell therapy, because I've done, obviously, yes, I've done research about it myself, and I've said the same thing. It's just, a little scare tactic. I'm more so of a scare tactic on recovery processes, to be honest. I'm one of those, if I like to bounce back quick. So I kind of I don't know, I kind of would wish it for everybody else. So if that makes sense. So with the surgery like that, I was going to say, how do you feel about recovery and everything?
Well, for the gene therapy, it's like they said it's supposed to be like a transfusion. So I think the most is the chemo, and think that, like, I look up the side effects of chemo, like it might make you weak and nauseous and things like that. And I do hear that you can still have like your pain episodes and crisis during that, so that might be tough as well. And then your immune system, so you have to be careful because your immune system is weak. But after, I think they give you like the stem cell, they said it's like a transfusion. I don't think the recovery process is bad from the transfusion or however they do it. I feel like the bone marrow might be more
longer. So now that you are on this journey, I'm pretty sure you're going to start advocating and documenting.
I want to do it, and then I want to document my process if I can ever get through this freezing thing. I do have the medications ready to go to start injecting myself to freeze the egg. So I've been going at it since last year, since I've heard about gene therapy. So once I do that, I'm off to do the gene therapy and make everybody proud, my family proud, all the warriors that behind me proud.
Yes.
And hopefully
Well, Melissa, I'm going to wrap this up, but I do want to say I'm behind everybody else for you. I'm with you on this journey, and I pray it goes smooth sail and you give us a beautiful baby. So, is there anything you want to say to the warriors while we close out?
Mind over matter. You can do whatever you want. Fight, advocate for yourself, no matter what. And we're going to live to our 100. Don't let anybody tell you anything otherwise.
And that concludes our episode for today. Thank you for joining us on Warriors Within. I like that.